This module is radiation biology, and in this section, we're going to learn just about the different ways that radiation can have an effect on the body, the ways that injury is caused, and what those resulting injuries are. So, we're going to go ahead and begin with radiation injury. And basically, there are two different types of radiation injury that we're going to discuss. Whichever type of injury it is, it all starts with the patient and the radiation. Not all x-rays will pass through the patient and reach the film or reach the sensor. Some are going to be absorbed into the patient's tissue, and that is where the injury is going to begin. Basically, once that radiation is absorbed, there's going to be a chemical change that occurs inside, and what we have is a resulting biological damage. And there are, as I mentioned here, two different types of radiation injury that can occur. The first one is ionization. Ionization is basically the process of when an atom becomes an ion, or when an atom gains or loses an electron. So with ionization, an electron is So with ionization, an electron is ejected and is set into motion. That electron is then going to interact with other atoms in the patient's tissue. So remember, everything is made of atoms. So that electron is going to interact with other atoms in the patient's tissue and is going to create more ionization. So there's this constant process happening inside the body where atoms are losing electrons and then atoms are gaining electrons. This is all ionization. So because of this, there is basically constant chemical change or potential for constant chemical change going on at the cellular level, and the result is biological damage. However, there can be a little effect on cells, so ionization can cause a little effect if chemical change does not alter sensitive molecules or sensitive cells within the body. So, for example, if ionization does not cause any damage to structures of great importance to cell function, such as DNA, there will be little injury there will be little injury occurring or little biological damage occur. The second type of radiation injury is called free radical formation. This mainly occurs when an X-ray photon ionizes in water or ionizes water, which is, of course, the thing that we are mostly made up. Human bodies are mostly made of water. So when ionization occurs within that water, we have free radical formation. So, what is a free radical? A free radical is an uncharged atom that exists with a single unpaired electron in its outer shell. So there is a neutral atom, uncharged meaning neutral, and there is on its outermost shell, because there are 7 shells, so on its outermost shell, there is one single electron that also has no pair. This can make this highly reactive and very unstable. These form when the X-ray photon causes water to ionize. So again, an uncharged atom exists with a single unpaired electron in its outer shell. So 7 shells, very last shell, one uncharged atom, it's neutral, has one unpaired electron, it becomes unstable and highly reactive. And this occurs when the X-ray photon causes water to ionize. And again, I'll repeat, we as humans are mostly made up of water. So, what do we do to fix this? Or how do we prevent it? Can we prevent it from happening? We are going to try to stabilize those free radicals. or that's what our body is going to do. We are going to react, our body is going to react, and we are going to try to achieve stability of the free radical. And how are we going to do that? There's a couple different ways here that the body will do. The first option, remember, this is all happening at the tiniest possible level inside our body. We don't even know that this is going on. But the first thing is that that uncharged atom can attempt to recombine or will recombine without causing any changes in the molecule. So it'll find another similar atom out there and it'll pair up with it. So it'll recombine without causing any changes in the molecule. Everything's good. Everything kind of goes back to quote unquote normal. Another option or another thing that may occur is that it can combine with other free radicals and that will cause changes. And the last option is that it could combine with other ordinary molecules to form a toxin that is capable of producing a widespread cellular change. So it'll recombine or it will combine with other molecules and it'll form something totally different. Think of it again like baking. If you are making that cookie dough and you're reading through the recipe, you've got everything ready to go, and then you see that accidentally you used salt instead of sugar. That is going to create a taste in your cookie that is probably not very good. Although it won't be a toxin, and it's probably not going to cause cellular changes within your body, it's not going to taste very good. So you've combined all those ingredients expecting to get that cookie and get that good tasting cookie, but instead you've created kind of a quote unquote toxin for your taste buds because you've used salt instead of sugar. So, this last one, think of it that way. It's combining with ordinary molecules, all your ingredients are ordinary, to form a toxin capable of producing widespread cellular change. So, that's basically how the radiation injury can start. But then there's two theories that further this idea of radiation injury or this concept of radiation injury. And these are your theories of radiation injury. We've got two of them. The first theory is known as the direct theory. So this suggests that cell damage results when ionizing radiation directly hits critical areas of the cell. This would be if that X-ray photon directly hits DNA. There's definitely going to be some kind of damage there. That DNA is kind of like your basic building block. So if it hits that, there's going to be damage. That would be your direct hit, direct theory. Damage will occur, causing injury to the irradiated organism. But the good news is, if there's any kind of good news here with radiation injury, is that direct injuries don't occur that often. They are infrequent. Most x-rays are going to pass straight through your cells and they're going to cause no damage. The second theory of radiation injury is going to be the indirect theory. And with this theory, it suggests that X-ray photons are absorbed within the cell and cause the formation of toxins which damage the cell. I found an error on that slide, so I'm starting over again with that section. This would be the second theory of radiation injury, indirect theory. So the second theory of indirect radiation, scratch that, let me try that one again. So the second theory of radiation injury is called the indirect theory. This suggests that X-ray photons are absorbed within the cell and cause the formation of toxins which damage the cell. So, as we previously mentioned, the X-ray photons are absorbed by water. They form free radicals, which form toxins, which can cause damage. So your indirect theory has a lot more to do with those free radicals. It's being absorbed within the cell, it's causing that molecular change, and it creates those toxins, and the toxins cause damage. So it is not the direct hit that results in the radiation injury. This type of injury occurs more frequently because we have that high water content within our cells. Our cells are 70 to 80% water. So that's what gives us that greater increase in our chances of having indirect radiation injury versus that direct hit. So if all radiation that causes ionization is harmful and can potentially produce biological damage, is there any level of exposure at all that we would consider acceptable? There are some guidelines that go along with that, so the answer is of course. And to understand that, we have something that is called the dose response curve. And basically, what this means is that the damage of tissue is related to the amount of radiation received. So there is a response to the dose of radiation that the body receives. This has something called a non-threshold relationship. So a threshold dose level for damage does not exist. So what that is saying is that no matter how small the amount of radiation is that is received, some biological damage will occur. This can also be called the non-threshold dose response curve. So it doesn't matter if you've taken one radiograph or if you've taken 30 radiographs, there is still a chance that there will be biological damage. And even though in dentistry, the dose that a patient receives is very low, damage still does occur. Biological effects from radiation can then further be classified into two other categories. These are known as stochastic and non-stochastic. Your stochastic radiation effects, those occur as a response to the dose. So as your dose increases, or the more exposure the patient were to have to radiation, the probability of there being biological damage occurs, or the probability of the damage being worse occurs. Gonna restart the slide on stochastic effect. I got ahead of myself and flip-flopped two of the things here. So with that being said, here we go. The effects of radiation can further be broken down into two other categories, and these are called stochastic and non-stochastic radiation effects. And the first one we'll talk about are stochastic radiation effects. And what this means is that the radiation effects will occur as a response to the dose. Negative side effects are more likely to occur as the dose is increased. So if your patient comes in, one X-ray, done, less of a chance that there will be major side effects. As you give more radiation, so they come in for a full mouth series, so they have a large number of radiographs taken, you're increasing the chance that there will be more negative side effects. You're just increasing the chance because the severity does not depend on the dose. You could kind of sum this up by saying that these kind of happen by chance, or these negative side effects happen by chance. And an example of these would be cancer or leukemia. This is one concern that you will hear a lot from patients as they come in through the dental office. is they might decline radiographs because they're worried about getting cancer. This is where you would be able to explain to them that the likelihood is small because there's such a small dose of radiation in dental radiology, and you just need to make them feel comfortable with it and give them a basic synopsis so that they can understand and accept to get those radiographs so that proper diagnosis can be made. So then we have non-stochastic radiation effects. These are effects that do have a threshold dose and increase in severity with the increasing absorbed dose. Some examples of side effects for this kind of radiation effect would be arrhythmia, loss of hair, cataracts, decreased fertility. And you need large doses to cause these kinds of serious changes. So we've got the different theories of radiation injury, and we've got how the dose can affect the outcome or what biological effect will occur because of the dose. But no matter what, there's sort of a sequence that always occurs with radiation injury. So we've got the sequence of radiation injury. The effects are not always immediately visible. So for that patient that had a large dose of radiation and is having their hair fall out, it doesn't happen with the first dose of radiation. It's usually after a few trips, and every person's different. So, you may know somebody that it did start to happen with the first large dose, but generally speaking, it's not always going to be immediately visible. There are 3 periods that will always follow in sequence. That first one is going to be called the latent period. This is the time between exposure and the appearance. This is the time between exposure and the appearance of clinical signs. So you get your first dose of radiation, nothing happens really. You get your second dose of radiation, and all of a sudden you start to see that hair is falling out. And again, that's a large dose of radiation. That is not dental radiology. That is not the radiation a patient will receive in the dental office. This latent period, though, can be short or long, just depends on the total dose received and the amount of time it took to receive the dose. So, the total amount received and the amount of time it took. So, did they receive this total amount in a month, 6 months, a year? All of that is going to make a difference in the latent period as well as other things here moving down. So more radiation plus a faster dose rate would be a smaller or shorter latent period. So coming in for a weekly dose of radiation is going to have a shorter latent period. The second period in the sequence of radiation injury is the period of injury. This includes a variety of cellular injuries. And these injuries are things such as cell death, changes in function, breaking or clumping of chromosomes, formation of giant cells, and after that we'll move into what is called the recovery period, where cellular damage caused by radiation begins to repair. Not all cellular radiation causes an injury that is permanent. Every time there is exposure, there's going to be cellular damage, and then there's going to be cellular repair. And most of the damage that is caused by low-level radiation, so low level, that's kind of what happens here in the dental office, low levels of radiation. Those are repaired within the cells on the body. So the likelihood of seeing any effects is very, very small because those cells are going to repair themselves. However, constant exposure to radiation is cumulative. So repeated radiation exposure will eventually lead to health problems. And here's just some examples of what those problems. Here are just some examples of what different health problems can be, depending on what tissue or what organ is radiated. So if it's your bone marrow, that can cause leukemia. Your reproductive cells can cause genetic mutations. Your salivary glands are injured, it can cause a carcinoma. Thyroid and skin can also cause carcinoma. And if the lens of the eye is damaged, it can cause cataract. This is why it is also exceptionally important for you to protect yourself as the operator, because you can have that scatter radiation that can hit you and can cause negative side effects for you as well. Because remember, you're in there every day. You're, being exposed to it potentially every day. But if you're taking the proper precautions, you will be safe. What are the items that can determine the amount of radiation injury you will have? Or what are the factors that will determine that? First thing is going to be your total dose. This is the total amount of radiation that's been received, or the total amount of energy that will be absorbed. More damage will occur when tissues absorb large amounts of radiation. The next determining factor is the dose rate. This is the rate at which exposure to radiation occurs and absorption takes place. So I previously stated, is it someone who's coming in every single week? Are they coming every month, every 6 months, once a year? How much radiation, what rate of radiation is being given? Remember, previous slides said that low levels will repair at the cellular level. High dose rates will cause more damage because it doesn't allow for that cell to repair. So if they're coming every day, they're coming every week, that's less time between doses that will that's less time between doses that their body has to allow itself to heal itself and to allow those cells to repair. But if they're coming this month and then they don't come for another 3 or 4 months, that's allowing plenty of time. I shouldn't say plenty of time, but that's allowing a lot of time in between for those cells to repair. Another determining factor is the amount of tissue radiated, or what area was exposed. Total body irradiation will have larger effects than if a small area was exposed. So what are we comparing here? Someone who's exposed to nuclear energy daily versus getting dental radiographs taken every 6 months. That person who's exposed to nuclear energy daily has a much greater chance of having a negative side effect than the person who's just getting dental radiographs taken every 6 months. The next determining factor is cell sensitivity. More damage will occur in cells that are most sensitive to radiation. This is cells that divide quickly or cells that are young. And the last factor is going to be age. Children are much more susceptible to radiation damage than adults. They have young cells. Their cells are still developing. Remember, they are not fully grown yet, so they are more susceptible to radiation injury. There are a couple of different ways that we can describe the radiation effects that may occur. The first one we're going to use here are short. The first one we are going to use here are short-term effects. This is when a person may receive large amounts of radiation absorbed in a short period of time. So if there is an exposure to a nuclear accident, that's a large amount of radiation in minutes, seconds, hours. So that could lead to something called acute radiation syndrome, or ARS. some of the side effects to that include nausea, vomiting, diarrhea, hair loss, and hemorrhage. These type of effects typically are not applicable to dentistry. So then we have long-term effects or small amounts of radiation over long periods of time. These are going to be repeated low levels of exposure over longer periods of time. And these types of exposures can be linked to cancer, birth abnormalities, and genetic effects. These type of exposures can be linked to cancer, birth abnormalities, and genetic defects. We can also begin to discuss the radiation effect on cells. And all of the cells in our body can be classified as one of two types. The first type is known as somatic cells, and these are cells in the body except reproductive. And the other type is genetic cells, and these are the reproductive cells. So somatic is everything except reproductive, and then genetic is reproductive. Two types of cells means we have two types of different effects. So the first is going to be somatic effects. These are going to be seen in the person that was given radiation. These effects will produce poor health, such as cataracts and cancer, but they do not get passed down to future generations. So it stops with the person that received the radiation. Genetic effects are not seen in the person who received radiation, but down the line in future generations. These type of effects are not seen in the person who received radiation, but down the line in future generations. And that happens because there are changes made to the genetic cells. And remember, the genetic cells are the reproductive cells. So there's a mutation that occurs at that level and affects the health of children, and it cannot be repaired. This is one reason why it's important to ask women if they may have a chance of being pregnant, because genetic effects. If that woman is pregnant and receives radiation, it could cause that mutation to the reproductive cells, could cause any mutation to that child. Let's go a little bit further now into radiation effects on cells. Remember that the cell is the basic structural Remember that the cell is the basic structural unit of all living organisms. Inside is the central nucleus, and then it is surrounded by cytoplasm. Ionizing radiation can cause effects on the nucleus, the cytoplasm, or the entire cell. But the nucleus is more sensitive to radiation. Since the majority of DNA is found inside the nucleus, this can be a bit of a problem because damage can affect DNA, which disrupts cell division, which can then alter cell function or death. So it can alter cell function or cause cell death. And all cells are going to respond differently to radiation. Some cells are what we consider to be radiosensitive, which means they're sensitive to radiation. And some cells are considered radioresistant, which means they are more resistant to radiation. And how sensitive or how resistant cells are is determined by three things. The first thing is called mitotic activity. Let me do that one again. Going back. How resistant or how sensitive a cell is going to be determined by three things. The first one is mitotic activity. This is where cells that divide frequently are more sensitive. The second thing is cell differentiation. So immature or not specialized cells are going to be more sensitive. So remember, children were more sensitive to radiation. So those young cells, they're immature or they don't have a specialized function yet, are more sensitive. And the third thing is going to be cell metabolism. Cells with a higher metabolism are more sensitive. So example of cells that are radiosensitive: blood cells, immature reproductive cells, young bone cells, and small lymphocyte is the most sensitive. And small lymphocyte, those are part of the immune system. So those are some of the most radiosensitive cells. And radioresistant cells are bone, muscle, and nerve. So cells make up tissues, and tissues make up organs. So if we have radiosensitive cells, we're going to have radiosensitive tissues. So radiosensitive tissue is made of radiosensitive cells. So those tissues that are most radiosensitive are going to be the lymphoid tissue, bone marrow, the testes, and the intestines. And the radioresistant tissues are going to be salivary glands, your kidney, and the liver. Now, there are certain organs that, if damaged, will totally deplete our quality of life. So, those are known as critical organs, an organ that changes the quality of life if damaged. So, these are very, very important, and they are oftentimes exposed more to radiation than others. And some of those organs are going to be the thyroid gland, your bone marrow, skin, and the lens of the eye. A lot of people forget that your skin is an organ, and your skin is one of the largest that you have because it covers your entire body. So it is very important that that is taken care of and protected by radiation with radiation protection procedures.